When you have pain and weakness in your legs, your sense of control is weakened. You cannot muster enough strength to move, and you feel weakness in your legs. This makes you feel uncomfortable doing even simple tasks. Moving and staying upright depends on the coordinated work of several systems in the human body. A problem in any one of these systems can cause discomfort, leading to weakness and pain in the legs. Other accompanying symptoms, such as numbness, tingling, or weakness in the arms, can indicate the extent of the problem. Weakness and numbness in the legs can come on suddenly, or it can have been going on for some time. In either case, however it develops, it should be taken seriously. This could be a sign of a serious medical condition. What causes leg weakness? Living things need to use different systems in a coordinated way to survive and move. These systems are the nervous system and the musculoskeletal system.
A problem in one of these systems can cause weakness in the legs. In later stages, this can lead to the inability to walk or stand. Apart from the nervous system and musculoskeletal system, factors such as aging, lack of exercise, chronic diseases, sleep disorders, malnutrition, vitamin and mineral deficiencies, and a sedentary lifestyle can also cause leg weakness. Diseases of the nervous system. The nervous system is divided into two parts: the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and spinal cord. The peripheral nervous system is made up of nerves that leave the spinal cord and travel throughout the body. So how does movement relate to our nervous system? Impulses from the part of the brain involved in movement are transmitted as electrical signals to the spinal cord and peripheral nerves. These impulses travel from the nerve endings to the muscle cell.
The resulting chemical changes stimulate the muscles and movement occurs in the muscles. In a healthy person, the movement signal sent by the brain is successful. However, diseases that can affect the nervous system prevent this process from working properly. This can lead to weakness, loss of strength, and sensation in the legs. Disorders and diseases that can affect the nervous system include weakness in the arms and legs can have many causes related to the nervous system. These include: there may be a vascular blockage, bleeding, trauma, tumor, or infection in the part of the brain where the movement stimulus should start. In addition, if there is a metabolic disease of the brain, the impulse for muscle contraction may not be initiated at all. Problems that develop on the nerve pathway after the stimulus is initiated have a negative effect on the strength of the muscle contraction.
For example, a herniated disc that compresses the nerve root in the spinal cord, or nerve root compression due to a slipped disc, spinal cord injury, infection, and tumor processes in the spinal cord can weaken signal transmission. Poor signal transmission can lead to loss of strength, weakness, and sensation in the legs. This can be accompanied by symptoms such as numbness, tingling, and burning in the legs. Even if the impulse leaves the brain and travels smoothly down the spinal cord, weakness and loss of strength in the legs can still occur. This is due to compression of the peripheral nerves or damage to the nerve structure caused by various diseases. Peripheral nerve damage can be caused by a cyst or tumor around the nerve, which can cause compression.
Cutting the nerve or certain diseases, such as diabetes, can also damage the anatomy and physiology of the nerve. This can result in weakness, numbness, and loss of sensation in the legs. Musculoskeletal disorders. For healthy movement, it is as important for the electrical impulse to reach the muscle as it is for the muscle to respond to the impulse. Some disorders of muscle metabolism can prevent the muscle from responding to the stimulus by contracting, resulting in a loss of strength. These diseases include the following: myopathy. Refers to a group of diseases in which muscles become weak or atrophic, shrinking of a normally sized organ. This can be caused by genetic or acquired disorders of muscle metabolism.
Inflammatory myopathy refers to a group of diseases characterized by inflammation around muscle cells. These diseases can affect the function of muscle cells, leading to weakness. Mitochondrial myopathy, a disease caused by the inability of mitochondria in muscle cells to function normally. Mitochondria produce energy in muscle cells. They are therefore essential for muscles to work properly. If the mitochondria do not work properly, weakness and wasting can occur. Neuromuscular diseases. This is a group of diseases that affect the communication between the nervous system and the muscles. This group includes diseases such as ALS, polio, and spinal muscular atrophy, SMA. These diseases can cause loss of strength by preventing muscles from contracting normally. Glycogen storage diseases refers to a group of diseases in which glycogen cannot be stored normally in muscle cells. This can have a negative effect on muscle function, leading to weakness.
These diseases can be caused by various disorders of muscle metabolism and can cause symptoms such as weakness, muscle pain, and muscle fatigue. It is therefore important to consult a doctor and get help for correct diagnosis and treatment before the diseases become serious. In addition, some systemic diseases, vascular occlusions in the legs, and metabolic muscle diseases can also lead to a reduction in healthy muscle mass and cause weakness and loss of strength in the legs. Chronic diseases. Chronic diseases are conditions that last a very long time and are often not completely curable. However, some conditions can be controlled and managed through lifestyle, diet and exercise, and medication. Examples of chronic diseases. Myasthenia gravis is a chronic disease caused by the immune system attacking the body's own tissues. It can cause weakness, especially in the muscles of the face, neck, arms, and legs.
Multiple sclerosis, MS, is a disease that affects the central nervous system, brain, and spinal cord. It attacks the immune system's protective coating called myelin. It can slow down the transmission of nerve impulses and cause muscle weakness. Inflammatory myopathies are a group of autoimmune diseases that affect muscles. It can cause muscle weakness, fatigue, and pain. Parkinson's disease is a neurodegenerative disease caused by the loss of dopamine-producing cells in the brain. This disease can cause a decrease in body balance, movement coordination, and muscle strength. Other chronic conditions that can cause leg weakness include diabetes, heart disease, arthritis, anemia, lung disease, and kidney disease. If you experience weakness in your legs, you should have your chronic conditions checked regularly. Chronic conditions can cause general weakness.
Vitamin and mineral deficiencies. A lack of vitamins and minerals that affect muscle metabolism can cause leg weakness. In particular, vitamin D, vitamin B12, magnesium, and potassium deficiencies play an important role in leg weakness. Vitamin D is important for healthy bones and muscles. Vitamin D deficiency can cause symptoms such as muscle weakness, muscle pain, and fatigue. Vitamin B12 deficiency can cause nervous system problems, weakness, fatigue, and muscle weakness. Magnesium deficiency causes symptoms of tiredness and weakness. Constipation, vomiting, and nausea may also occur. Potassium is an essential mineral for muscle function. Potassium deficiency can cause muscle weakness, fatigue, and cramps.
Digestive disorders can cause vitamin and mineral deficiencies due to poor absorption of nutrients from the intestines. A low-protein diet can also lead to muscle loss and leg weakness. This is why you need to pay attention to your diet. Which doctor should I see for leg weakness? For leg weakness and other accompanying symptoms. Orthopedics and traumatology, physical therapy, brain surgery. You should see a neurologist. If the weakness is only in the legs, there is no loss of strength in the arms. There is no loss of cognitive functions such as speech and comprehension, and the weakness is accompanied by symptoms such as numbness, tingling, burning in the legs. It is most likely that the problem is caused by the spinal cord. In such cases, you should consult a specialist in orthopedics, traumatology, or neurosurgery. The cause of this condition may be a lesion such as a herniated disc, spinal canal stenosis, abscess, or tumor pressing on the spinal cord.
If you experience loss of strength in only one leg and the pain is accompanied by radiating pain, numbness, tingling in the leg, we recommend that you see an orthopedic and traumatology or neurosurgery specialist. The cause of this condition may be a herniated disc or other cause that is compressing the nerve root in the spinal cord. Sometimes compression of peripheral nerves can cause a similar clinical picture. It may even be difficult to distinguish from a problem originating in the spinal cord. The orthopedic, traumatology, or neurosurgery specialist you consult will make a differential diagnosis based on the examination findings and tests. If there is loss of strength in one or both legs, as well as pallor, bruising, and hair loss on the fingertips, and no pulse in the legs, we recommend that you see a cardiovascular surgeon. If weakness in the legs is accompanied by weakness in the arms, there may be a problem with the brain or cervical part of the spinal cord.
A neurologist or neurosurgeon will be concerned about blockages of blood vessels in the brain, strokes caused by bleeding, abscesses, and tumor-like growths that damage brain tissue. In these cases, changes in the patient's level of consciousness, understanding, and speech are usually observed. If there is weakness in the arms and legs, but there is no change in consciousness, and the patient can perform cognitive activities such as understanding and speaking, this may be due to a problem with the cervical part of the spinal cord. In this case, we recommend that you consult an orthopedic and trauma specialist or a neurosurgeon. Unilateral weakness in both the leg and arm is often caused by the brain and should be treated by a neurologist or neurosurgeon.
In chronic conditions, leg muscle weakness is usually associated with some systemic disease. In these cases, you will need to see the specialist for your chronic condition. How can leg weakness be treated? To prevent loss of strength in the legs, the first step is to treat any underlying causes. These causes can include infections that affect the brain, spinal cord, peripheral nerves, and muscle tissue, or conditions that can cause weakness such as masses and hernias. After you have been examined and seen by a specialist, you should get the treatment you need and follow these leg support recommendations. Eat a healthy diet. Malnutrition can cause leg muscle weakness. For example, people without a healthy diet may be deficient in calcium, vitamin D, and magnesium. These nutrients are important for maintaining healthy bones and muscles.
Vitamins K and E are also essential for blood clotting, blood pressure regulation, heart rhythm management, bone strength, and immune system function. Fiber-rich foods, whole grains, vegetables, and fruit should be consumed to prevent vitamin and mineral deficiencies. Dietary changes can help correct electrolyte imbalances. Your doctor may also recommend taking supplements such as calcium, magnesium oxide, or potassium oxide. If you're not careful about your fluid intake, you may experience problems such as tiredness and headaches. Avoid smoking, alcohol, and drug abuse. Exercise. Regaining leg strength is an important part of your recovery. To improve the strength of your legs, you should exercise regularly under the supervision of your doctor or physiotherapist. Exercises such as walking, cycling, and aqua aerobics are effective ways to improve your circulation and muscle strength.
Getting enough sleep. Lack of quality sleep can also cause leg muscle weakness. Lack of quality sleep can also slow down the production of growth hormone, which declines significantly after the age of 50. As a result, muscles weaken and symptoms such as hand tremors, stiffness, and weakness appear. Whatever the cause of leg weakness, it is possible to slow or reduce muscle loss. People with leg weakness and fatigue are more likely to fall or injure themselves, so reducing or improving the factors that lead to chronic disease and a sedentary lifestyle can help you live your best life. Conclusion. Weakness and weakness in the legs can be so severe that it interferes with the functioning of daily life. In this case, movement becomes a real pain. If it is accompanied by other symptoms such as numbness, tingling, or weakness in the arms, it may be a serious condition. If it is serious, it is not possible to recover without consulting a specialized doctor.
On the other hand, weakness and numbness in the legs can be caused by many conditions. Therefore, a specialist should determine the cause of the problem and develop an appropriate treatment plan. BioFlex wishes you healthy days. Don't forget to like and subscribe.